There was a chap in France named Yves Cotrel who came up with the concept that, gee, if you put a hook at either end of a rod and push out, you have two hooks bearing a lot of force. And yes, it works. But if you put a whole pile of little hooks all the way in between, and they each pushed, then each one would have a little bit of force. You wouldn't be putting the same global amount on one part, and maybe the instrument wouldn't fail. And maybe it might be a little more secure. Well, he was absolutely right. And his modification of the rod was another big sort of turning event. And so now the rods are titanium. They're attached with both screws and hooks. There's multiple fixation points. And just to compress 20 years of evolution down into a sentence and a half, we can now get the person up as soon as they can tolerate getting out of bed, a day or two after surgery. We don't worry about the stability of the implant anymore. It's fine. You heal just as well getting up and walking, probably better than you do lying around, and you get home faster, and you get back to school a couple of weeks later. So the social impact of the curve is a little less now than it was then. It's still a major insult to anybody, an invasion of your body and having somebody rearrange you and put all these things in, and it is not comfortable, as you may recall. So it's still a big deal, but technology has helped us a lot. And the ability to monitor people while they're asleep to make sure that their muscles are still moving properly, it's another great big advance.